It's sparking a wider discussion about why rates for cervical cancer and other preventable diseases are climbing and what we can do about it. For more, let's bring in CTV's medical expert, Dr. Marla Shapiro, with more. Good morning, Dr. Marla. Great of you to be here. So let's start with cervical cancer. What are we seeing across the country right now?
So, you know, the news that we've looked at measles, we've looked at pneumonia, now we're looking at cervical cancer. These are preventable diseases. So when we looked at what happened from the mid-'80s up until about early 2000s, we were seeing this downward trend in cervical cancer that was continuing to go down. And that's a reflection of screening, it's a reflection of prevention and the tools that we have. Then about 2005 or so, we began to see annual variability. Went down, went up, but pretty much plateaued. But as of 2015 or so, what we begin to see is a rate increase in cervical cancer of about 3.7%, and that makes it one of the fastest rising female cancers. And that's really bad news because it is preventable. We're expecting over 1,600 cases to be diagnosed in Canada this year. 430 deaths are projected, and that's really above our elimination target of about 4 per 100,000 people. That's what we've been striving for. And it really reflects the fact that we are not doing what we should be doing. We know that there are higher rates in rural and lower income areas. That's an equity and social determinants of health that we need to address. But if we look at the overall trend in Canada, we have to ask ourselves, why are we here compared to, for example, Australia, that's about to eliminate the disease, and the fact that we had a target for 2040 that we're not going to see. So if you look at the provincial breakdown, that 4 per 100,000 is the magic number that we were aiming for. You know, you can see in the east it's about 10 per 100,000. It's about 8.3 per 100,000 in Ontario. You can see that all of them are almost double what we are trying to reach.
So what's going on? Why are these numbers on the rise? As you mentioned,
so
there
we
is
know,
screening.
And we know it causes the disease.
Vaccine.
We know that almost all of these diseases, cervical, vulvar, vaginal, anal cancers, head and neck cancers in men, are caused by the human papillomavirus. And we've had a very available vaccine that's very effective to prevent the diseases. Remember, screening is early detection. This is about prevention. In 2019, 2020, we saw that the vaccination rates at schools almost disappeared, and that's because of COVID. Very slow to come back to the table. So when we look at, are we vaccinating enough? Are we doing regular screening enough? The answer clearly is no, that we're not getting the message out that this is a preventable cancer. We have a vaccine to prevent this cancer. Even in women who have had changes within their cervix and have not been vaccinated at a young age, we still recommend vaccination to prevent recurrence, yet we're somehow not getting this message across.
Quickly, before we get to the bigger picture here of what's happening. When we talk about screening, what is that? That's the
PAP. Okay, so that's changed. So typically we did a PAP test, which was a smear that looked at cells for early detection. Now, in many provinces, but not all, for a woman it feels the same. It feels like you're doing the same test, but what I'm looking for is high-risk HPV. We're screening for the actual presence of the virus, and that can tell us if the virus is present, what your risk is for developing cervical cancer, and furthermore, we can test for the very high risks, HPV types, because there are many different types of HPV, other risks that are high but not as high, and if you're negative, it allows us to increase the interval between screening. And in some provinces, we are uploading at-home testing, so access is not a barrier. That's going to take a while to lay out all the provincial guidelines in terms of doing home testing. But we have the tools. We have the vaccine.
We have the tools.
So, you know, what's the messaging?
And as you and I have talked about, this is just part of a growing trend of preventable diseases now on the rise. Why do you think the message is not resonating as much?
Measles elimination, we lost our status. That's all about vaccinations. It's very simple. It's about having 95% of the population vaccinated so we break that train of transmission. We haven't done that, and now we're trying to get back our elimination status. We talked about the fact between 23 to 24, we've seen pneumococcal pneumonia double in visits when we have vaccines for kids and adult-specific pneumonia vaccines. Here we have an HPV vaccine for boys and girls, men and women. That is very important to prevent HPV cancers, particularly head and neck and throat in men, and vulvar, vaginal, cervical cancer in women. Yet somehow, we're not getting people to the table to be vaccinated, and even when we have some universal programs available at school where the vaccines are free.
All right, Dr. Marla, glad you're here. Another important conversation. We'll talk to you again next week.
See you then.